And I will introduce this by mentioning some of the backgrounds why we're doing this with a system transformation from a healthy risk-sick perspective, and where do we spend our resources. So SweLife, we're a national innovation program within life science, about 20 very large strategic projects, the ones that I work with, and then we have around 100 innovation projects. And examples of strategic projects are, for example, then of course, our dear Prevention of Childhood Obesity, cell and gene therapy, national biobanking, and genomics medicine Sweden, informatics. So those are some of the examples. So where do we spend our resources here within a healthy risk-sick perspective? And how do we do this system transformation? And then I will also mention Prevent Childhood Obesity, and thereafter Peter Bergsten will tell us more about our large project. So some background facts here. WHO estimates and indicate that at least 80% of all heart disease, stroke, type 2 diabetes, and at least 1/3 of cancer cases are avoidable and preventable. So 80% is an estimate. It's also clear that our systems will crash if we don't do anything about that. And what is the return on prevention? What are the economics of prevention? There is a ratio from OECD that every dollar spent on preventing obesity generates an economic return of up to $6, making prevention interventions an excellent investment. So the third question, what do we spend on prevention? If it's an excellent investment, what do we spend at this stage? And unfortunately, we only spend 2.8% on prevention in OECD and only 3% in Sweden. And this is why we're doing Prevention of Childhood Obesity, to really do it more right from the start. More facts here. What really affects health? From New England Journal of Medicine, our lifestyle affects health with 40%. Our family history and genetics affects with 30%, and we will work more on the genetic side as well to understand how to keep healthy. But really, we have a lot to do just on the 40% lifestyle. And then we have the environmental and social factors, and there it affects by 20%. And healthcare, the very strange and sad part here is that healthcare only affects by 10, let's say 20% what affects health. But unfortunately, we spend basically 90, 95, 97% on the healthcare part, trying to fix health when it's already gone wrong. So therefore, we must really transform our system so that incentives, for example, the Nobel Prize, incentives, payer models, business models, our investments really go towards trying to do it right from the start. Because if we look at it from this healthy risk-sick perspective, keeping us healthy here, we only have to pay 1 crown. If we go all the way here, there is enormous suffering and personal costs and societal costs, and it costs 6 crowns. So invest 1 or pay 6. It's an easy choice, but this system transformation is not so easy, but that's why we're doing this childhood obesity project. And many of us have been thinking many times of how did it become this way? Why are we working with this, spending all our resources on the sick system? And of course, it's our history. I mean, it came from the Academy of Army Surgeons in Sweden. We have the Karolinska Institute at Lund, Uppsala, all our old institutions. And there it was, of course, I mean, it was army surgeons. The problem is that it's still most prestigious to be the surgeon. But now we really have in the future here, it's more a war against our own behavior and how we have, how evolution have created us, because we really, if we see food, we're going to eat it. So it's a war against ourselves, and the situation is more that people are dying from obesity than starvation, and 80% the burden of disease can be prevented. But we only spend 3% on prevention. So this is why we're doing system transformation, really working on this part, the prediction and prevention part. Of course, we shall go on and do the diagnosis and treatment as well, but we have to do something about this, that we only have to spend 1 crown or euro or dollar here to keep us healthy, instead of letting it go and having to have suffering and personal costs and societal costs, which cost 6 crowns or euro or dollar here. So what we really do to prevent diabetes type 2, heart and cardiovascular diseases, 30 to 40% of cancers, and also, of course, it's a risk factor within COVID-19. It's the prevention of childhood obesity. And of course, we have to change our incentives here. And these are the 24 parties in Sweden that we're working together with, and also doing this grand challenge. Anders and the gang from RISE and SAS and the whole hackathon work that we're doing here, apart from the work packages in the project. So we're doing this whole very large, basically global invitation to work with prevention of childhood obesity within the hackathon. We're very, very happy to have this collaboration, and thank you so much also for listening to this. And I'm really looking forward to this hackathon. And also a personal thought here is that we can do so much more with gamifying health applications. Because, for example, in Sweden, we have a very strong gaming industry. So we have to take more of the gaming principles into health in a good way, so that we keep healthy. And then I will just say thank you very much, and I will hand over to my colleague in the project here, Peter Bergsten.